Let the recording start. Well, welcome everybody. My name is Denise Harlow, CEO of the National Community Action Partnership, and thank you for joining us here literally in the middle of July to talk about CSBG care spending. Many of you were with us several months ago. I want to say it was mid-April, perhaps, where we did a national webinar with all of the national partners, just like today, to talk about CSBG care spending with hopefully enough advance preparation that spending could pick it up a little bit and we could get our numbers up a little bit higher. And I think you'll hear today that we have had movement in the right direction, which is very positive. However, we are still under some very tight timeframes now that it is the middle of July for the spending of CSBG cares. In today's webinar, we're going to talk about what does this mean for CSBG eligible entities, local community action agencies. We'll talk about state associations, and we'll talk about state CSBG offices. Next slide, please. Let's start off and ground ourselves in this work with the promise of community action. Community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. And I know that many of you were with us with CAPLAW in Chicago just about a month ago, where we did a similar panel conversation with this, and Sharice Johnson was with us from OCS. And I know that her message was that, and again, it links to the promise. The spending of CSBG cares is not about spending federal money, although in some ways it is, but at a broader level, it is truly about helping families in this moment in time. Everyone in this country has been touched by COVID. Today's economic challenges, inflation, supply chain issues are tied back to the global pandemic. And so the promise grounds us in the why we need to spend this money. We're going to talk about the how and the technical pieces and the urgency, but the why is grounded in the promise of community action. Next slide, please. Joined today by a panel that we could sit up here and talk all day about a variety of topics, but folks have really generously given of their time today. We're joined by Verna, the new branch chief over at the Office of Community Services, and many of us have known Verna for a number of years during her time in North Carolina. We're glad to have her with us here today. We have David Bradley from NCAF, our leader on the Hill, whose success brought in that $1 billion of CSBG cares that we're here to talk about today. Alison Malouf with CAPLAW. She has a number of her team members here as well from CAPLAW to provide that deep level of technical expertise that CAPLAW is well known for. Jeannie Chaffin is here, who is currently the interim executive director over at NASCSP, and understands CSBG from its core and truly trying to link local agencies, state associations, and the state CSBG offices and the roles we all have to play. And then Lana Shope, our CARES funding project director here at the partnership, formerly with the State Association in Iowa, has been really the leader here about pushing out really good information and is tracking what's going on all over the country in terms of good ideas about spend down and things like that. So next slide, please. And I am pleased to turn the microphone over to Verna, who's going to be walking us through where we stand in the spending of CSBG cares. And we're going to start with this slide with Verna, just to remind us all that CARES funding is there to help us prevent, prepare for, or respond to COVID-19. Verna, thanks so much for being with us here today, and I'll turn the microphone over to you.
Thank you, Denise, and good morning or good afternoon, depending on what part of the country you're representing, to everyone who's joining us today. For those of you who may not know me, or for some who may have forgotten me, I'm Verna, the Program Operations Branch Chief for the Office of Community Services in the Division of State Assistance. And may I please take a moment to say, I am so humbled and excited to be back serving in the community action family. I missed you all so very much, and I'm looking forward to working alongside of you all until there is no more work for us to be done as it relates to ameliorating the causes and conditions of poverty. I also bring you greetings on behalf of our devoted OCS director, Dr. Laniqua Howard, and I know you were likely expecting my division director, Sharice Johnson, who sends her sincerest regrets for not being here, and she sends me. So let me get to work. I want to thank the partnership for the opportunity to join in on this critically important conversation and call to action regarding the status of CARES funding expenditures, as well as opportunities to continue serving communities through this time of great turmoil. I think it would be helpful to refresh our memories about the purpose of the CARES Act funds and why it is so important to spend these dollars. While the nation continues to recover, the cost of rent, utilities, food, and gas have risen sharply, further straining the budgets of low-income individuals and families, where the impacts of the pandemic have been felt most disproportionately. I also want to share that for the past 5.5 years, my work has been on the ground in two of the most vulnerable geographic regions in my local county. In addition, I had the opportunity to serve in an emergency response center, fielding calls as well as making arrangements for housing through mass shelter at the onset of the pandemic. I share this with you because I want you to know that I have been up close and personal with the sheer devastation that families continue to try and recover from. The toll on mental health and wellness, financial fallout due to unaffordable medical costs, burial expenses, delivery fees, and just to meet basic needs for food and shelter. Hearing of learning loss for our children, the increases in domestic violence, as well as child abuse and neglect, and the list goes on. As you all know, these issues don't have a one and done solution. This is why it's imperative for us to think broadly and act swiftly to use the available CARES dollars. Let me be very clear. We want every available dollar at work in our communities. This is probably a play on words, but as I thought about it, I said, let's show our community just how much CSBG cares by mobilizing these resources for maximum impact. Though things have slowly begun to return to normal, the effects of the pandemic are still present and relevant. Therefore, the encouragement to spend the funds is not just about ensuring that they are not returned to OCS. It is truly about ensuring that we have met the needs of communities that we serve in new, impactful, and innovative ways. If we look at slide 5, the CSBG CARES Supplemental Grant recipient funding, we can see the current trends across states, territories, and tribes. This pie chart shows the aggregate spending across each of these grant recipients, and we have seen positive movement across the board, which is excellent. All states have spent at least 25% of their funds, with the majority spending at least 50% of their funds, and one state that has spent their funds. That's the green that you'll see on the pie charts. I don't know if you all remember The Wiz, where they had a scene that said, I want to be seen in green, and we want all of these to turn green. The pie chart for territories has not changed. However, OCS has been working with them, and they are spending their funds as well. And more than half the tribes have spent at least 50% of their funds, and almost a quarter spending 100% of their funds. We are hopeful and hoping that by the end of the month, all CSBG grant recipients have spent 50 to 75% of their funds, and we applaud you and are excited to see the continuous progress. Slide 6, the CARES Supplemental Regional Funding. Across the regions, there has been tremendous growth. In April, you may remember that the majority of regions had only spent about 25 to 50% of their funds. As of July 12th, Most of the region has spent between 50 and 75% of these funds. I'm hoping that you all are giving yourselves some virtual rounds of applause here. If we look at slide 7, we'll see that we are moving in the right direction, but there is much more that we can do. From January to July 2022, states have 22% of the CARES funds that have been dispersed, from which 77% of CARES funds dispersed in total. 23 states have dispersed more than 75% of their FY 2020 and 2021 CARES funds. All 12 small states have dispersed 100% of their 2020 CARES funds. Let's look at slide 8. Here we'll see that our tribes are making similar progress. From January to July 2022, tribes have dispersed 5% of CARES funds, with 53% of CARES funds dispersed in total. 34 tribes have dispersed greater than 75% of their fiscal year 2020 and 2021 CARES funds, with 20% of those tribes distributing 100%. So we are really excited about that. As you know, OCS continues and will continue to provide some TNTA to states regarding CARES spending. Program specialists have been reaching out to the states that have slowed their spending or seem to not be spending quite as fast. We will be scheduling additional calls with national partners to help answer any remaining questions from CAA, states, and associations regarding anything else as we look towards closing out our CARES funding. So the only other things that I would share with you all today is that I have been encouraged, even though I've only been on a couple of weeks. I've seen some very promising practices that I've learned about through the information shared during the DCA quarterly calls. I've seen excellent examples of work that's being done relative to food security, mobile service delivery, financial literacy, and credit repair. And I'm hopeful that there are many efforts that are ongoing as it relates to workforce retooling to include pathways to entrepreneurial development. And I think, it behooves us to also be very thoughtful about how these resources can also address the larger systems of injustice. So just as a reminder, please, please, please be reminded that there is no option for carryover of CSBG CARES. Funds must be obligated by September 30th, 2022, with the exception of small states. We're asking that the Community Action Agency, financial officers, and fiscal teams monitor spending, send the invoices into the state within the required timeframes, and you all have heard this before. Any training that is being done at the associations needs to be rendered by September 30th, 2022, because there is no carryover. There is no carryover option, and be mindful of the liquidation timeframes, recognizing that funds must be liquidated by December the 30th of 2022. I want to thank you all for being attentive to these matters. Again, thank you to all of the national partners for your efforts to support this work. And if all goes well, I certainly hope to see each of you in August at the partnership conference. So Denise, those are all of my remarks. I hope that's helpful, and I'll turn it back over to you.
Thank you so much, Verna. Really appreciate it. And echoing your comments that there is no carryover of CSBG CARES, and we'll be repeating that several times as we go through here today. Just going to flag for the team, making sure that we are able to see who we need to see on the screen. Sorry about that. So I'm going to turn it over next to David Bradley. David, we so appreciate all the great work you did on the Hill. Although it seems like it is years ago now, but that was a very hectic time, fresh in your memory, I am sure. But your work on CSBG CARES allowed us to have this $1 billion to reach out and to help families, as well as to keep agencies primed and ready to be able to be the recipients of other money. As always, CSBG is a leverage point, and we so appreciate you being with us here today. What message would you like to send to the network regarding CSBG Cares?
Well, thank you, Denise, and thanks everyone for joining. I just have a few comments to make. First of all, I think CARES Act, the $1 billion, which it wasn't an intense 3 weeks, but that is an incredible vote of confidence by Congress, by Republicans as well as Democrats in the Community Action Network. A lot of programs didn't make it in the CARES Act. We did. And when you get a Tom Cole and a Rosa DeLauro both praising the $1 billion investment in CSBG, or Chuck Schumer taking credit, which he did, that is really historically important. That rather than say, don't blame me, somebody else did it, it's everyone taking credit and feeling comfortable with that. So that the CARES Act was an incredible vote of confidence that does open up vistas and opportunities for a long, long time for us, not only on future crises to be involved, but also on opportunities that we're taking advantage of now. But with that comes some obligations. With that comes some risk and some challenges that we have to make sure. So number one, on carryover, absolutely. Some of you came to us months ago about carryover. We cannot go to Congress and say we couldn't spend the money you appropriated. We couldn't do it. It would absolutely destroy our appropriation strategy, not only for FY23, but beyond. It's going to be a problem. So number one, there will be no carryover. We will never raise that question with Congress. It just won't work. Second, as you know, there is increasing congressional focus, discussions, oversight on how CARES Act and all of the recent expenditures by Congress, how effective they've been, and what fraud has occurred. You're reading that in the papers, but there's clearly far more interest in the results and how those dollars were applied in their communities. So for us to get $1 billion means that we really have to pass a high bar and do this as best as possible. So I think I want to make 4 points. Number one, I think OCS, I think many states, not all, but many states deserve a terrific round of applause. The CAP network, the state associations, the national partners, everyone has pulled together on this, and that's refreshing and rewarding to see, number one. Number two, 2 months left. We need to get this. I would feel more comfortable if we're in the 85% range across the board. We still run across comments by members about ARA, and particularly on the weatherization side. So people have long memories when you do initiatives like this, big supplementals. And the price tag on this was a lot of money, as you know, and $1 billion for us is a lot of money. So people are gonna remember how we performed. So lesson number one is no carryover. We have to spend it. Lesson number two is we got 2 months left. Let's crank it up. Let's do the best that we can so that we can report to Education, Labor, Health Committee, but most importantly to leadership, both R's and D's, as well as the appropriators. If we don't spend as much as we can on this, I guarantee you it will complicate FY24 approps, which is going to be difficult for domestic programs anyway, and possibly FY25. And if you're in a small state, and I recognize that small states are really pulling their weight on the CARES Act money, we got a lot at stake on basically doubling your money in our reauthorization bill. And we need that trigger of $915 to $950 million appropriations to make it all work. Well, that would be incredibly complicated if we're looking at 200 million that we didn't spend, for instance, in the CARES Act. Number three, point that I want to leave you with, and then I've got a fourth. Number three is, if we don't spend it, you've got to be prepared to say why in writing, and we need it. Questions come up constantly on approach, how we're doing on CARES Act, from friend and potential foe, but we've got to say this was the problem. This was the problem with our state legislature. This was the problem in disbursement from the state. This was the lack of communication from federal to state or state to local. We've got to be able to explain why and why it happened and how to learn from it so that we can be in a position, if there is another crisis, that we have an opportunity to insert community action as part of the solution. And the final thing is, if we don't spend it, we have to be prepared to withstand some criticism. And I mentioned earlier about the long memories, either staff or in reports that people read and refer to. We've got to be prepared to. There's going to be some hard questions going forward, and they're going to be consistent. They will not be just a burst for 1 or 2 months. They may linger for a few years. We've got to be prepared to push back on potential criticism out there on why we didn't do it. So everything is important. Spend what we can as best as we can and as obviously accountable, but spend what we can, do the best we can in the next 2 months. Second, if for some reason we fall short, be able to explain why and an honest assessment. If it was problems in locally, problems state, problems federal, just an honest assessment so that we can learn from it, but also reassure our congressional base that it won't happen again, that we've learned from these mistakes. And then third, be prepared to help defend the program. To me, the CARES Act and the investment of $1 billion is sort of the linchpin to the future. Here we inserted the network as part of the solution on a crisis not only in America, but around the world. But community action really plays a positive role in communities. And when you think about responses to issues far beyond our capability of controlling, but you have to have community action as part of the response. Congress did that. And what that is, what that opens up is an avenue of talking about other needs in low-income communities, all centered around active community action participation, community action involvement, and CSPG dollars. So there's a lot at risk at this, and there's a lot at stake. If we do well, we are, I think, set up for a really, really exciting time. I really mean that. I'm not just saying that to end on a happy note. The opportunities that are going to come to this network, and I hope maybe in New York I can unveil a couple that are moving on. The opportunities are going to be there for us. Things that we've never dreamed of, that we're being invited to participate legislatively. This is a good time, but this is the most important test and challenge facing us. We can do it. We always have. We can do this. We can do it well. We can do it accountably. And most importantly, we can do it successfully in our communities. But the stakes are high. So we need your help. And everybody is in this together. The OCS, the states, associations, the CAPS, the national partners, everybody wants us to succeed. And I know we can do it. So Denise, that's my comments, and I'm sticking to them.
Thank you, David. I think those are your 3 takeaways are critical for folks, and we'll make sure to reiterate them as often as we can as well. We appreciate your leadership, and glad you were able to be on today to send that message. So we're going to bring the slide deck back up and walk through some core elements of things that we want to make sure that folks understand, be able to take questions. Please use the chat window or the Q&A button. We'll be monitoring both of those. So we'll want to keep an eye on that. So if we can bring up a variety of folks on the spotlight screen, that would be great. So some things to remember. I see that we can see the slide deck. CSBG has a high level of flexibility. I think that is something that we definitely have talked about, and that flexibility with CSBG goes right along with CSBG Cares. That flexibility remains, and that's always been kind of the strength, that is the strength of CSBG: local control, local decision-making, local flexibility. I'm going to pause here to see if we have some tech we're able to bring up, folks. Maybe I'm just not looking in the right view. All right, and CSBG Cares can be used to meet unmet needs and address gaps in services. Again, so long as people and families and individuals are income eligible, 200% in most parts of the country. We know there are pockets where the 125 is where it's at. And the agency documents how the needs and services related to COVID-19 and its impacts and its consequences. Yeah, I'm going to pause and see if we can't bring up the other panelists here. Let me see. Sorry, folks. Technology sometimes is our friend and sometimes not so much. All right. Sorry, folks. We'll get this straightened out. And then the care spending timeline, where folks had been, we've been talking about this already, right? Verna and David have both been clear. The care spending deadline is September 30, 2022, with the exception of small states. Now, there is an additional nuance with the small states, and I'll ask my colleagues here to correct me if I'm wrong. But our understanding is that if you're a small state, right, you technically got 2 tranches of money. You got the first batch, and then there was a second round. That first batch, that first tranche, that first allocation does have the same spending deadline as the rest of the states across the country. So I'm going to pause there and let my colleagues see what they would add to that piece of the conversation. Allison, Jeannie, anybody, Lana?
My understanding, Denise, the same with respect to small states, that they have until September 30, 2023 to do the CARES spend down, to complete their CARES spend down of that second installment.
Agreed.
Go to the next slide, please. We keep talking about the small states. Unless you're a small state, you may not know who the small states are. I try to keep sticky notes on my computers where I can to keep these at the ready. Alaska, not quite a small state geography-wise, but they are considered as a small state in this scenario. Delaware, Hawaii, Idaho, Montana, Nevada, New Hampshire, North Dakota, South Dakota, Utah, Vermont, and Wyoming. So when you saw the slide that Verna was talking about the percentages, in some of those places, right, there are small states which have additional period of time to spend down the majority of their CSBG CARES dollars. Next slide, please. Some key terms that we wanted just to make sure, because we've heard some confusing things out in the network at times when we're talking to people about spending CARES money. And we just want to be kind of, I don't know if we can be crystal clear, but hopefully we can add some clarity, or at least put something in the back of your mind that if I hear this term, I really need to know what this term means. We encourage you to make sure that fiscal and program folks at your local agencies are talking with one another, right? Fiscal's going to have a view and understanding of these terms. Programs, you kind of need to know as well and work together to make sure your agency is spending thoughtfully and in a way that's going to be in compliance. And we encourage you to talk to your state CSBG office as well if you have different questions or concerns, or what does this mean in my state contract? And we also encourage you to reach out to CAPLAW if you have specific questions, if you get confused about a particular issue or other financial go to the source. You want to go to experts that you trust who understand these financial terminology. So we just want to be clear about that. So these are some of the things to have in your mind. Be clear what your project period and your budget periods are, right? So we've been talking about CSBG CARES, and then so we have until September 30, 2022 for the large states to spend their resources. We've heard there's no carryover. That budget cannot be carried forward. Your budget period ends September 30. State contract period, we believe in some places around the country, states in your contract around CSBG CARES may have sent an earlier contract deadline date. And I think in some of those states, there's been some extension to allow for full expenditure of the resources, but you need to pay attention to your state contract dates as well. You'll hear the term obligate the money. You need to obligate the money no later than September 30, but in our scenarios as we talk here today, that really means obligating the money way before September 30, because you're going to need to expend the money, which means you need to receive the product, receive the service, attend the training, utilize the computer you bought, utilize your vaccination van that you purchased perhaps, right? You can't purchase things on September 30 because they will not have been able to be received and expended in your budget period. So we want to be clear about that. And as we talk about grant spend down, just really want to be thoughtful about that. Then you need to make sure that you're invoicing, or whatever other term your state contract has, right? You're invoicing your state, so you can be paid for those activities, right? And you have a liquidation period to get paid from the state, and the state has a liquidation period to draw down from the feds to possibly pay you. Not all states do that in a cycle. Some of them pay you and then they draw down. It really kind of depends. And Jeannie may be able to talk a little bit about that. But the state then needs to make sure they draw down this fall. You're not going to be able to draw down in January. And that PMS system can sometimes have glitches. We don't want to be waiting on stuff. And we'll turn to Jeannie here in a few moments to talk specifically to states. And we know your state offices, right? You have a lot of different buckets you're drawing down on, right? Don't let them forget about CSBG CARES. Please don't let them forget or put it off because maybe it's a smaller amount of money for their particular drawdown. These resources are critically important. So I'm going to pause and ask Allison or Jeannie, what did I get wrong that you want to clarify? What would you amplify or add to?
I would just, I think that's right, Denise. And I would just say, just to be 100% clear, you have a 90-day period after the date that the budget period, project period ends. And in this instance, your end of your budget period and project period is also the end of your period of performance. So everything ends September 30th. And so when that ends, hopefully you've obligated your dollars, you've actually used them in some way, but you may not have actually paid out everybody that helped you with respect to the service or the program that you were providing or the resource that you purchased. Maybe you haven't actually paid that bill yet. And so you do have 90 days, but you have used the product, you have provided the service. So you have 90 days after September 30th within which to what is referred to as liquidate that cost, that obligation. So then during that period, you would do your final drawdowns and you would get the money that you need to pay and to liquidate those costs. And so you want to make sure that you're invoicing, that you're getting the invoices from your vendors. But if you're under contract, you'll see that the that serves as the obligation that's necessary to make sure that when it does come time to liquidate that cost, you can. That's all I'll add with respect to that.
I can talk about this some more later too, but since you kind of introduced these terms, I think it does just remind everybody that your normal federal grant requirements apply here. That there's nothing, you don't spend outside the budget period for Head Start, normally. So you wouldn't do that for this, right? And so that budget period is really important. And, one of the, we're talking about the pandemic, and we have all kinds of inflation, and we have all kinds of supply chain issues because of all this. And that means that some things that you might want to purchase can't be delivered by September 30th. And so that means you can't deploy it, you can't get value, you can't get use of it. Your communities can't. And so that would be something that you should not do, right? Like I think I gave this example when we were in Chicago together. I remember being at the OCS office and reading some OIG reports under ARA where people had bought computers that were delivered after the budget period and weren't put into service before that period, and those were disallowed costs, right? So those are the kind of things when people come back and look that they will ask. So we all want folks to, utilize the funding to help communities and people who are struggling, but we don't want anybody to do silly stuff, right? So one of the greatest things about community action and state CSBG offices is that we have a lot of experience in managing federal grants. I would put our processes and systems and controls up against anybody's in the country. So this is an opportunity for us to use all those controls and systems and processes and do good with it, and just make sure we're following all the rules. I want to say some more about invoicing and timeliness and drawdowns, but I'll wait till a little later to do that.
And absolutely, Jeannie, this is not new. None of this is new. I think that's important to say. This slide is just a reminder of what we already all do with respect to all of the federal funding we receive, in addition to the current CSBG funding we receive. There's project periods, there's periods of performance. We're spending out the differences with our regular CSBG funding. We have this carryover option, which we don't have with the CARES money. There's no carryover with the CARES at this point, unless you're a small state, and that has to do with your having received the funding in 2 allotments. But absolutely, these are not new rules.
Let's go to the next slide. So we'll reiterate again, there is no carryover for CSBG CARES. This is going to be a recurring theme. But it goes to something that you were just talking about, Allison, I think, right? Sometimes when you have carryover, right, you're not so worried about that last penny on the last day. In this scenario, we're worried about the last penny on the last day. We have CSBG CARES money, training and team money at the partnership that's hosting part of today's webinar. And we're talking about how early in the month of September do we need to have that money spent down to ensure that we've spent every dollar of our TNTA resources, not to leave a dime on the table. And again, we need to monitor spending, send invoices, and we also have new people all the time. That's the other thing, right? There's always new people coming to the network, and if technically it says we can obligate on such and such a date, well, why can't I just spend down my grant on September 30 to buy a bunch of supplies? You can't do that. You got to be able to receive the supplies, use the supplies. For new folks, when you hear some of this stuff, the technical stuff versus the practice, we really need to be talking about the lessons learned. There's a lot of experience in the network about where we've bumped our head against things in the past. So just really want people to be aware that this may seem, well, of course, we're going to do it this way, but we get questions all the time, which is one of the reasons why we want to iterate this, because some of the questions concern us. that we get, just to be transparent with that as well. People in communities still have needs: food, gas, formula, rent. There's an asterisk there about mortgage, but we'll talk about rent, food, and gas, and other things, right? The inflation we just saw, right? 9.1% since last June. Cost of everything is increasing. And we talked a lot in Chicago about gift cards and the ability for agencies to distribute gift cards with certain controls in place. And we can certainly talk more about that, but we just want to make sure that people are knowing that the resources now are meant to help people who are impacted by the pandemic and the inflationary situation, and our economy has been impacted by COVID-19. And avoid stockpiling. That goes to buying, your year's worth of ink on September 30. You don't want to be stockpiling things that aren't really going to be used in this project period, in this budget period. So I'll stop saying that as well many times. Allison, Jeannie, what else would you add to that?
I just might add just one other way to think about the need to purchase and use the product or to engage in the activity is, and this is just another way to think about what we've already been saying, is that, when you're using federal dollars, whatever you're using those federal dollars for need to benefit that federal program. The federal dollars need to receive that benefit during that period within which you have to use those dollars. So if you're purchasing something or you're providing a service and it's not benefiting that period within which you receive the dollars and within which you were directed to use those dollars, then you're not benefiting the federal grant. And so that's just another way to think about what we've been talking about. And I'll just also want to add, there is still great need. And I think the reason to keep kind of putting in some version of bullet 3 on this slide, and Lana has a whole presentation for bullet 3, and we've just put it in one bullet here, is that there still is need, and the pandemic is still going on. We are in surge right now in certain parts of the country. And so PPE is still potentially necessary to protect employees, to help clients receive services, and also being able to have the technology to provide the services when a client or when a community is really heavily impacted by a surge in an area. We also are still in a national state of emergency that has not gone away. And so even though we are doing our best as a society to try to manage our lives with respect to this pandemic, it is still heavily impacting the communities that we serve.
Allison, I think that's a great point. And in a conversation with the Community Action Agency a couple of weeks ago, we were talking about in their program design of Head Start, they don't provide transportation. So Head Start families have to get their kiddos to the Head Start Center. It's a rural area that could be very, very expensive right now with gas prices the way they are. And so a case could be made that providing gas cards to those Head Start families to make sure they can get started with their Head Start year, maybe the first month, that case could definitely be made for that. And coordinating, what you're using the CSBG Cares dollars for with other important programs like Head Start is, makes a lot of sense. So I think folks can really think a lot about, where might our current customers be having challenging transportation issues because of the gas prices that, are stemming from the pandemic.
And I see a lot of questions, which is fantastic. A lot of things in the chat. We have some team members behind the scenes who are compiling these, and we'll definitely be circling to the questions. So keep putting them into the chat. And we'll circle back to them as we go forward as well. So next slide, please. Let's talk a little bit about state associations. state associations, you have a couple of buckets you need to worry about, right? You have, again, no option for CSBG Cares carryover, whether that money came from your RPIC, because the RPIC got an additional supplement to the RPIC grants, and that money needs to be spent by 9/29/2022, because that's the RPIC timeline. So everybody else, don't just ignore that piece except for the state associations. If you receive money from your state office for training in TA, those would have the September 30, 2022 deadlines. But again, if I were you, I wouldn't worry about that and spend it early if you can. And you have the same rules and regulations, right? You can't pay for a training that's going to happen in October with CARES money, because that all has to be spent by the end of September. So just keep that in mind. Any trainings or services purchased, again, would need to be hosted and held before September 30. Travel, different places like that. You can't buy a plane ticket in September to go to a conference in October, right? We need to make clear that what happens has to happen in that program and budget year. And keep in communication with your state office, as well as your community action agencies. We turn to you every day to try to find out what's going on at the local level. So thank you for all of the work that you're doing. We appreciate it. All right, next slide, please. State offices. Jeannie, we're going to turn this over to you. Again, there's no carryover for CSBG Cares.
Right. And I was glad that somebody asked early, well, is there option for carryover? And David clearly said, he's not going to go to Congress and ask, for the CARES money to be extended. That is just not an option. Congress trusted Community Action Network with delivering value to folks who needed help during the pandemic, and we're going to do everything we can to make that happen. I think that the new thing here on this slide, outside of affirming that states have to follow these same guidelines, is that we really want to encourage the states that are on the call today, and we'll keep reiterating this with states from NASCSP perspective, to work with your state financial teams. The folks in the basement of the Department of Budget and Finance who draw in the money from HHS, from the payment management system. They have a process, and sometimes it's months before they may draw in money. And we really want state program offices, state CSBG office directors, to have a conversation with the financial folks, the budget and finance folks who do the draws, and encourage them to do the draws timely. As you can see, OCS is looking at this data monthly, and if a state isn't drawing in money, the data is a little laggy. And folks, as you heard from David on the Hill and other places, are already asking, well, how is it going? And as soon as September 30 comes, people are going to start to look and say, okay, where have we landed? And the sooner that we can have solid numbers, if we can get good numbers in October, November, December, it's much better than January, February, or March, right? So that whole drawdown issue and invoicing, we really, we want to do the right things all the way along and be timely all the way along till we're completely closed out when we have that final number. And we really need everybody working together. So state, I know many program folks are very far away in space and time and connection to the folks who draw it in. So just take some time in the next couple of weeks and have some conversations with people up the line from you, and kind of emphasize, because they don't care about CSBG as much as you care about it, right? So just affirming with them the importance of this, that lots of people are looking at the data and lots of people are asking questions, and we just need everybody to be timely.
Next slide, please, which I think is our, what do you need from us? So I'm going to turn to our team behind the scenes. I know there have been a number of questions. If there's something, if someone can unmute and perhaps pose the questions that you'd like us to respond to, that would be great. I know that while they're doing that, I know the gas card question is the most recent in the chat that I've seen. Gas cards are an allowable CSBG expense. Your state is not allowing you to purchase gas cards. I would encourage you and your state to have a conversation with NASCSP, and partnership and CAPLAW are happy to do that as well. Some states do have some things in place to not have that happen. And what we want to do is try to explain how other states do allow them, how they put in the safeguards, right, to ensure that people receive their gift cards, what the rules and regulations are about once you give the gas card to an income qualified individual or family, how you document that, and how that has satisfied the needs for many years in CSBG. Anything, Allison, Jeannie, you'd want to add to that particular question?
No, and we've sent numerous emails out in response to this question. So anyone who has this question should just ping us directly. You can email me. My email information is at the end of the slide deck, and I can make sure you get in touch with someone at our organization who can help you. You can also just email info@caplaw.org, and we'll get that question and we'll make sure it's answered. And we can give you some information in writing with respect to it. But that is what you need to kind of help move this needle forward.
I think the
I do
only
have
thing
a-
oh, sorry, go ahead, Lena.
Nope, go ahead.
I was just going to add that, you know, if you're at a community action agency and you say it's your finance office that is like looking for thicker ice underneath, you know, people have different feelings about how thick the ice has to be. You know, maybe the program and finance folks could get on the phone with the state and talk with the state, and maybe there are things the state could say or ask for, or suggest that might help your finance office feel like the ice was a little bit thicker underneath them on that.
Great.
And Hugh also noted, I'm not sure, I think maybe he intended it to go to everyone. And it may have just responded to the person who was asking the question, but he also noted that states, there are a number of states out there that have been working with CAAs with respect to gas cards and cash cards. And so he's more than happy, he and that team are more than happy at NASCSP to talk, you know, with the state and work with the CAA and the state to help the state get a level of comfort around this if they're struggling, and also the finance department and your CAA if they're struggling.
Allison,
Okay.
I don't know if you
Oh.
saw on the, there's a Q&A about tuition, and somebody was asking that, you know, if the course starts before September 30, but of course it might not finish, what the perspective on that, what might you consider as you're thinking about that question?
Yeah, so I think that's an allocation issue. I mean, I think, you know, any sort of education provided during the grant period would be allocable to the CARES funding. If it's extending beyond the grant period, you likely will need to move that allocation to a different, you know, to a different source of funding.
Thank you.
I did see a question in the Q&A about defining
No.
the word obligation. Does it actually mean spent? And I think that is where we get to some of the confusion, right? Obligation does not mean spent.
Right.
In terms of cashing, you don't have to cash the check. Obligating, though, could mean, right, that you are attending the partnerships conference at the end of September or the end of August, right? You have registered for that conference. You have bought your plane tickets for that conference. You have obligated your resources. But it's July 15th, 14th. You haven't traveled yet to New York City. You haven't attended the conference yet, but you will do so by the end of the project and budget period. So you have obligated the money. You will have expended the money at the end of August, and then you will invoice and get liquidated and get paid. So that those pieces will be in place. So obligating means you've committed those resources. You've signed a contract for some training at your organization in the middle of August, right? You may not have paid that consultant yet, but you have a contract with that individual. I'm sorry, Lana, I cut you off after I asked you to frame up the questions.
That's okay. I just was responding to another one because they're coming in fast and furious. Okay, we would like to provide a 30-day transportation. We would like to provide 30-day transportation passes to youth and adults for employment, camp, and other needs. What would be the client level obligation for collecting information on usage?
On, what is it? Say it again. I missed
On
that.
using the transportation cards.
Oh, on usage. Is that,
Yes.
You know, I think this is sort of how you frame up your program. You know, I think that just like, you know, with gas cards, you know, I think every state is different with respect to the level of accountability that may be required to document that use. But I think in general, there are ways to kind of frame it so that you can get a level of understanding that the card was used for whatever its intended purposes are. You know, if you're providing cards to a group of income eligible individuals to participate in programs, you'll know whether or not they're participating in those programs. They'll be in those programs. You know, you can pretty much see that if they need sort of assistance, it's just like sort of buying that book and making sure that they've read it. You know, they're gonna participate in the program, and hopefully they'll get out of it, and you've structured it in such a way that they'll get the benefit out of that program that they need to in order to move forward. And I think there's sort of ways short of, you know, you have to do this balance when you're seeking documentation. If you make it too onerous, then it outweighs the benefit that's being received with respect to that documentation that's being done. So I think there are ways that you could document it, you know, short of asking for a receipt from everybody with to like actually using the transportation. I think there are other ways that, and others might be able to jump into the chat box and note how they've sort of structured their programs with a similar situation like this. And I don't know if my team is on too. They might want to jump in because they've answered questions like this.
I was just going to jump in and mention that, you know, also sort of like risk assessment. Like, are you doing, if you did 3 months of gas cards and they dropped out of the program and, you know, after a month, and you'd given them 3 months, somebody might say, well, that's not really reasonable. And you didn't really protect your risk. Versus if you say, okay, we're going to give it in this interval, and we can verify that they're still attending, they're still participating, and it really reduces our risk. So I think if people have thought that stuff through and documented and can answer questions like that, you know, it increases the chances that folks will say, okay, this is reasonable. And, you know, we wouldn't see any reason why, you know, this would not be acceptable as you've designed it in your approach.
I also think too, there's, you know, spot checking depending on the size of the program and the number of cards that you're issuing. You know, you may not be able to verify every single card, but if you have sort of a systematic approach to you know, checking and seeing, then that could also help verify as well in situations like this.
Okay, I have a couple of questions. One has to do with buying appliances. What appliances are allowable? I'm believing my initial response was, I'm not sure how you connect that to the pandemic, but if you have an explanation of a justification of how the pandemic impacted a family's ability to, or inability to maintain their appliances, but I'm not sure how you connect appliances to the pandemic. So I'm passing it all to you, the experts.
I wondered the same thing, Lana, when I saw that question. But maybe they could provide more on how they might be connecting it, but that was my question too.
I feel like one area where we've seen appliances for cares would be things like air purifiers, and perhaps in certain, again, that's a clear tie to the pandemic. I know that, you know, for eligible entities, that type of appliance is seen as sort of PPE or an extension of PPE. And so perhaps you can make that justification for clients as well.
We'll give
Okay.
additional thought to the appliance question, but yeah. Okay, thank you. Lana?
You know, I think there could be some just thinking about it with respect to sort of inflation and sort of feeding families and making sure that you're able to keep your situation stabilized during this time period. You know, I think it's possible that, you know, if a refrigerator goes out or some sort of appliance that you would need to be able to kind of keep your costs down in general, but the appliance itself is now a lot more expensive because of inflation and your dollar's not going as far. I think there could be arguments around that could be made. I would just say, if you're going to do stuff like that, you need to have a program in place and a framework within which to support that provision of that service for your clients. And so there would need to be some sort of, you know, this is how we determine who's eligible for this, and this is how we determine that there's the actual need there, and then we're tying that service or that purchase of that appliance to that need, and this is how it's meeting that need. So, you know, if you could make the argument, we have a family of 5, their refrigerator went out, they're working 2 jobs, inflation has made it so their dollar isn't going as far as it was because of the pandemic, then, you know, getting the CAA helping with getting them the appliance that they need to be able to feed their family and get the food, I think is you know, something that could arguably be supported by a program.
Question, we usually pay for scholarships for a STEM program by the quarter. We would pay in August for August, September, October. Can we include the October cost?
Probably goes back to your cost allocation piece, Allison, that you were talking about earlier in that scenario, that some perhaps, but perhaps not all of those months would be able to be paid for out of CSBG Cares.
So yeah, so there, it's funny. So my team has been discussing tuition in chat since that question came up.
Okay.
And so I think that this is a tricky issue with respect to, we're hitting sort of the period in which the benefit to the program and so, you know, as we get closer and closer to the end, I think we need to think about services and benefits that you know, we're going to need to be able to show were received during the program or project period. And so I think that with respect to things like tuition payments, I think likely depending on, I don't know if we're talking about, did they say paying for tuition payments for clients or for employees? Did you already say that, Lana?
I don't know. For families, can families receive tuition assistance since school will begin before September 30th? I don't know if that's public school, private school, college.
Yeah. again, I think this kind of goes back to sort of kind of a framework for how you are using your dollars and sort of having sort of a, you know, is this, I think with respect to paying for that tuition, if the program is, again, extending well beyond September 30th. So for instance, if the program starts on September 1st, but it goes for the whole entire remainder of that year, I think you're sort of stretching it with respect to how much the CARES dollars are being benefited by that program that's crossing over the budget period line within which you have to use that funding and for which you need to show that that funding is being benefited.
Yeah, maybe I'll just add, I think that this is an area where there are probably going to be different, states may see this differently. When you have kind of these one-time upfront payments for tuition that are made, say, at the beginning of September, but that tuition payment is intended to cover the entire semester running through the end of December. Whether or not that entire benefit was used by the end of September, I think that's a question that is not in some ways entirely clear. I mean, if you buy a laptop and you give it to the client, you don't take it back necessarily at the end of September. So there's usage that extends beyond, the period. So you could sort of make an analogy to other types of goods or services that are purchased using CARES Fund that do benefit, at least a portion of the period. I think it's much harder to make it that kind of argument for things that are charged on a month-to-month basis, like utilities or rental assistance, when you know that you're paying costs that are used actually in October, and those are assessed month to month. I mean, I think we're having some of these conversations because it's not, I think, entirely clear how this would come out.
Yeah, and it could be a question of sort of substantial benefit, or what is the intended benefit, right? Like, and so I think that's what it drills down to is the intended benefit being received, and is it benefiting the program in the way that the program intends for those funds to be used and to benefit. So I guess all this to say is, as we get closer to that end date period, it gets a little trickier. And so if you are planning to engage in these sorts of ways to use the funding, reach out to CAPLAW directly and let us talk with you about it specifically. And we can do a little more drill down and research into this with respect to this issue, I'd say.
Leanna, I know there's a question in there about bonuses, and that was such a robust conversation at the CAPLAW conference. And we had so many, we had agencies in the room that were really doing creative things. And so I think it would be great if Allison could just for a minute address.
Yeah, absolutely. In fact, Veronica, can we spotlight Veronica? She just talked about this yesterday, and I cut her short. So maybe she wants to talk about it today. How about it, Veronica?
In terms of using CARES funding, to support incentive compensation, right? So incentive compensation is definitely an allowable cost under CARES CSBG funding. I think we would point to IM 157 to say that CSBG funds can be used to support staff well-being. OCS hasn't been as specific on the use of CARES CSBG funds for incentive compensation the way that OHS has, but if you look at the uniform guidance in the section that talks about compensation, salaries and wages, incentive compensation is a category of or type of compensation that is an allowable cost. There are criteria, so you have to have a written policy that's in place before the incentive compensation is paid. There are certain allowable incentive criteria, so efficient staff performance, cost-cutting efforts, suggestion awards, safety awards. These are all deemed to be allowable criteria. CAPLAW does have an article that discusses incentive compensation and some of the decisions around disallowances that have come prior to the pandemic that are good reference. And we have a compensation explainer on our website that talks about incentive compensation. But I would say the keys are to have a policy in place that you're implementing, that you're applying consistently to your workforce, that you're not making exceptions outside of that policy, that you have clear incentive criteria, whether that's, referring an employee who is then hired by the agency and then is, stays at the agency for a certain period of time, or excellent performance, that's documented in this certain way. And incentive and compensation is definitely an allowable cost.
I just want to add, do take a look at that compensation explainer. Maybe someone could put it in the chat from our team, because
Beth put it in just a minute ago, and
okay.
I'll put it in again.
Great, thanks. So right, someone said, "What's a COLA COVID bonus?" So, and that was that terminology that made me want to put the compensation explainer in there. So COLA and incentive compensation. So bonus is basically another word for incentive compensation. It's a one-time temporary discretionary payment. And so we try in that compensation explainer to kind of dispel and kind of clarify the different ways that you can compensate your employees and sort of what are the allowability framework and structure around those different ways. So it's important that you understand that, a COLA is a cost of living adjustment that is permanent. It permanently increases the salary to really account for things like inflation. And, the Office of Head Start recognizes the need for COLAs in their legislation. And when the funding permits, they get appropriated funding. When they get appropriated funding, they send out guidance with respect to how grantees are to implement that COLA increase. And so, unfortunately, there aren't a lot of other funding sources that account for cost of living adjustments within their legislation or in their rules. But there's nothing that prohibits the provision or providing of those. You just have to look to, as Veronica was talking about, the uniform guidance and the not really too onerous requirements around what is reasonable compensation, and having policies in place to support the providing of that compensation and making sure that you're looking at comparables and that you're within the ballpark as you're compensating folks. There is also the bonus, which is the incentive compensation piece, which is what Veronica sort of talked about in depth. And in addition to the compensation explainer, we also have a pretty nice article that kind of walks through incentive compensation. I will just add, incentive compensation is something that really has bubbled up. It's been around forever. It's been in the uniform guidance. It was in the OMB circulars. For those of you who have been with community action or federal grants for a long time, you'll know that that goes back a long ways. So it's not a new provision, and it's basically stayed the same throughout the federal grant rules. I do think that there's been a new eye that's been placed on it that has put it in a light of being a tool that can be used, especially during this time with respect to recruitment and retention, whereas in the past it wasn't so kindly looked upon. So when you're talking to states and you and your CAAs talking internally about incentive compensation, if you're feeling pushback, that's probably why. It's not always been an option, even though it's always been an option that's been available, it's not always been an option that's been looked to as a solution to a situation like this. But we are actually in really unusual and somewhat dire circumstances with respect to maintaining our operations and staff to support that.
Can I just add something about that particular treatment of incentive compensation? So you'll see in CAPLAW's materials and in the article that in the past, the Departmental Appeals Board has actually upheld disallowances of incentive compensation awards because it basically found that the agency had had a surplus of funds at the end of the grant year and had wanted to provide a bonus because they had the extra money. And that is not a permissible purpose for providing incentive compensation. So I would say that if you're thinking about doing an incentive award, like Veronica said, the policy has to be in place before the award is earned. And so in your conversations with your state office, you want to be thinking about justifying why now? Why are you doing an incentive award now? And you could cite the recent surge of COVID in your area or something like that as a reason for why you're doing this, say in August and September of 2022, as opposed to, previously. But the idea is that incentives should be set up and then earned under a specific policy instead of awarded retroactively.
And that was Caroline. I don't know if you can see her. I can't see her, but that was
I can
Caroline.
see her.
Oh, you can? All right.
Yeah.
It must just be the way I have my view set up. So sorry about that.
Before we pivot to the next question, I do have to bow out and get to my next meeting, but I'm going to leave you in the very capable hands of everyone here. So thank you, everybody, and I will see everybody soon. So good luck with the rest of the conversation.
Thanks, Denise.
And we have about, I'd say, maybe 10 more minutes.
Okay.
And we're going to have to bow out in about 10 minutes.
Okay. I'm just looking through here. Someone asked a question about giving Gaffes cards to staff.
Yeah, so we were actually chatting about that also internally here at CAPLAW. That's really an employee benefit. And again, you have to look to the uniform guidance with respect to the benefits that you offer your employees. And so it is, something that we need to be documented. There are potential tax implications with fringe benefits. So you just want to make sure that you're clear with respect to that. And again, we're happy to talk to CAAs and sort of do a deeper dive with respect to that. Because yeah, the bottom line is that's permissible. You just have to do it right and understand the implications.
Okay. Mary Beth, did I miss anything? Is there anything out there that I didn't get to?
So someone just asked, can incentive payments be justified because of the surge in gas prices due to COVID? And so I think what's important to note is when you're looking at incentive compensation, you're looking at how did our organization benefit from either really great employees. So we want to reward those employees for the great work that they've done. So you're giving it on an individual basis. So there's objective criteria that you're using to determine, achievement and performance that's been done well, or the organization is operating really efficiently now because of the work, and because of that efficient operations, you have money left over, or you want to, maybe you've served more people than you had, whatever your goals were. So those are the objective type of criteria that are used to determine the provision of incentive compensation. So the fact that inflation exists and so costs are more difficult and higher for employees, and it makes their living circumstances more difficult, that is arguably more of a reason why you would give a COLA increase, a cost of living adjustment, because you're trying to help your employees manage that inflation.
I don't know if we touched on this because I was trying to keep track of everything. Car seats, lots of questions about car seats.
Oh, and I'll just add, Caroline just mentioned in our internal chat that, doing gas cards is for your employees is much easier as a fringe benefit than as a, it's a permissible as a fringe benefit. Again, you just have to look at the implications, not so much as an incentive. It's not incentive compensation.
I think part of the confusion is sometimes we use this word bonus generically when we refer to like a gas bonus, but when we're talking about incentive compensation under the uniform guidance, there's a very specific meaning for it when you're trying to incentivize certain types of behavior, as opposed to like assistance for your employees in the form of fringe benefits like gas cards or health and wellness incentives. So those two just are they're different. Incentive compensation is a very specific kind of cost under the uniform guidance.
Yeah, and I'll push again. I'm going to sound like a broken record, like a broken carryover record, but no carryover. But I'll push again that compensation explainer, because it really does help to distinguish between these different types of compensation. And they're important distinctions, because cost of living adjustments and fringe benefits are in many ways easier and to put in place than things like an incentive compensation. Okay, car seats, right?
Yep.
So is that car seats for clients? What is that?
Yes, customers, yep.
You know, I think this is kind of along the lines of the kind of appliance argument. I think you have to sort of tie it to, you know, why now? Why are we getting car seats now? And I mean, you know, arguably, again, there is this inflation situation, and you might be able to say, in order for us to help our families, you know, get their kids to daycare or get their kids to a child care center or a babysitter or another family member so that they can go get work for, you know, go to their employment training or get their job. You know, maybe 6 months ago, car seats were more affordable, and now because of inflation, they're harder to get and they're not as affordable. And so, you know, I think, and that inflation was really brought on by many things, one of which being the pandemic and the disturbance of supply chains. I think those are the sorts of arguments you would have to make in order to support purchases like, again, appliances or car seats or that sort of thing. That's the way I would think about it. I don't know if anybody else, and not just, you know, Jeannie, me, and the CAPLAW, NCAF, NASCSP staff. I don't know if anybody else has any thoughts on, you know, arguments that could be made to support purchases of that nature.
I guess for me, my thought is if there's a connection to loss of income, if that person lost their job or if they got reduced hours and because of the increased cost and their child is of the age they need to move up to the next size car seat to be in compliance, I think that would justify it. But I think you need that justification to be able, or that explanation and documentation to be able to justify it. But I'm not an attorney, so that would just be my opinion.
Yeah, I mean, I think that, you know, this is no different than any other period with respect to having to tie the service or the product being purchased to the goals and purposes of the funding and whatever that community action agency plan is and whatever the need is. And so I know it seems sort of different because we have this layer of, you know, responding to preparing for preventing coronavirus. And so that layer, though, is quite broad because it has so heavily impacted our functions, the way we operate as a society. And so I think it's just sort of taking that layer and putting that on top of sort of this analysis that you do already and saying, you know, were the circumstances of these families that we're supporting in some way even more heavily impacted? And so I think your point about Lana, about, you know, job losses and things of that nature that can be tied to, you know, either inflation or supply chain issues or any of these issues that have risen out of the pandemic and persist because of the pandemic, or maybe you were laid off and you're having a hard time, you know, during the pandemic, and you're having a hard time getting a job because you don't have the skills that are in need right now. You know, just because there's a big employment market out there at the moment doesn't mean that all of our people are qualified for those jobs. And so we still have to do that work that we were doing before the pandemic to try to get them qualified. And those jobs have actually shifted to a degree as to what's needed. So, you know, I think there's a lot of connections that can be made. And I just think you have to think broadly and really think about the needs.
Great. All right. And with that, Denise, you want to go to the next slide, please? Just a reminder of what we've been doing during this pandemic, a nice little graphic that shows the work of the network when it comes to the readiness to meet the needs, your rapid response in meeting those needs, transitions as the communities and families recover, and how we're building resilience. If you haven't seen this yet, it is available on the partnership's website. You can duplicate it and use it everywhere. Next slide, please. We have 2 conferences coming up. The partnership conference is going to be August 31 through September 2nd in Washington, D.C. Next slide is the NASCSP conference, which is being held in Minneapolis on October 24th and 28th. And the next 2 slides have contact information for many of us who are on this webinar. Just want to say thank you. We had a huge level of participation in today's webinar. Thank you for your patience as we worked out some technology problems, and for all the questions and your patience as we tried to sort through those and get answers to you. But a special thanks to our experts who helped respond to those questions and make sure that our folks have the information they need to get the money spent. And can I close by saying, there will be no carryover of CARES funds. There will be no carryover of CARES funds for CSBG. Good luck, everyone. Spend that money. Thank you so much. Bye-bye.